Is this good? Oh, yeah, absolutely. Well, good morning, everyone, and welcome. It is my pleasure and honor to be moderating our first panel. This panel is on the topic of payment reform, and we'll hear perspectives from two of our colleagues in Ohio. And Mary Applegate is the Ohio Medicaid Director. She's a pediatrician and internist with over 2 decades of rural private practice. And I asked each of the two of them, to give me a little tidbit of information that you may not find in their bio. And so Mary was born on April Fool's Day. And so she suggested that I watch out because she's filled with fun and adventure. And she also has a twin brother, so that makes her, double trouble. So FYI, be on guard. Hopefully you've had your coffee this morning. Ted Wimslow is a family physician who previously served as the director of the Ohio Department of Health and is now the chief medical officer of the Ohio Association of Community Health Centers. And Ted enjoys fly fishing, so when he's not improving the health of Ohioans, you can probably find him in a nearby stream, hopefully not the Potomac River, with his waders on, chasing trout. And he has taught hundreds of others to fly fish, and you'll see in a couple of slides, he's also very interested in teaching future generations. So I'll leave that for when the slide comes up. So Drs. Applegate and Wimslow will each have about 10 minutes. They're going to do a joint presentation. So 10 minutes, 20 minutes, we have plenty of time to share some highlights of their experiences with public health and healthcare collaboration in the context of payment reform, and then we'll open the floor for discussion. And I would like to modify what Jose said just a moment ago. It's not just the speakers. We're really hoping that we can use the expertise and learn from all the members of the audience. So if people ask hard questions, the speakers may or may not know the answer, but if someone in the audience has a perspective they'd like to share, we really highly encourage that. So we are all teachers, we're all learners here. So before I turn the mic over to them, I did want to share a few perspectives on payment reform from the federal level. I work at the Health Resources and Services Administration, which is one of the agencies of the Federal Department of Health and Human Services. And you may have seen the recent blog posted on January 26th by the Secretary of HHS, Sylvia Matthews Burwell. The blog was entitled "Progress Towards Achieving Better Care, Smarter Spending, Healthier People." And she acknowledged the significant progress that's been made over the last several years, thanks in large part to the Affordable Care Act, and she asked how to take that progress to the next level. She described setting clear goals and establishing a clear timeline for moving from volume to value in Medicare payments, using benchmarks and metrics to measure progress and to hold ourselves accountable for reaching those goals. And this is noteworthy because this is the first time in the history of the Medicare program that HHS has set explicit goals for alternative payment models and value-based payments. The first goal is that by 2016, 30% of all Medicare provider payments be in alternative payment models tied to how well, not how much, providers care for patients. By 2018, the goal is that 50% of those payments would be for value, not volume. And she provided examples of models. I'm sure many of us or most of us are familiar with those. Models that put patients first, things like accountable care organizations, patient-centered medical home, and bundle payment models. The second goal is that nearly all Medicare fee-for-service payments be linked to quality and value, and at least 85% in 2016 and 90% in 2018 through programs or models like hospital value-based purchasing and the hospital readmissions reduction programs. She talked about making these goals scalable beyond Medicare and to facilitate public-private sector partnerships. So she announced the creation of a healthcare payment learning and action network through which HHS will work with private payers, employers, consumers, providers, states and state Medicaid programs, and other partners to expand these alternative payment models into their programs. The network is supposed to have its first meeting in March, and there will be more details announced in the near future. So no doubt many of you know about the Innovation Center at the Centers for Medicare and Medicaid Services, CMS, which is testing an array of alternative payment models and service delivery models through numerous demonstration and pilot programs. For example, the state innovation models. These fund states to develop innovative linkages between advanced primary care and public health through avenues of financing, data exchange, integration, performance monitoring, and other ways. In February of 2013, Ohio was one of the 16 states to receive a Model Design Award in round 1 of this initiative. So before we hear some of the details of that, I want to take one more prerogative as the moderator and just remind you that February 15th is the deadline for open enrollment into the insurance marketplaces. And at HHS, we are not allowed to go anywhere unless we remind folks about that. There are a lot of tools available on the website, hhs.gov. So if you have an opportunity to explore that or share or help anybody get enrolled in insurance who isn't already, please go ahead. So Dr. Applegate, Dr. Wimsel, the floor is yours.
Very good. Well,